In this video, we will discuss the anatomy associated with the intrinsic muscles of the hand. The intrinsic muscles of the hand have origin and insertions within the carpal and metacarpal bones. There are 4 intrinsic muscle groups of the hand. 1. The thenar group. 2. The hypothenar group. 3. The palmar and dorsal interossei muscles. And 4. The lumbricals. The thenar group of muscles include the opponens pollicis, the abductor pollicis brevis, and the flexor pollicis brevis muscles. All 3 thenar muscles are innervated by the median nerve. It is the recurrent motor branch of the median nerve that innervates the thenar muscles, except for the deep head of the flexor pollicis brevis, which is innervated by the ulnar nerve. The opponens pollicis originates from the flexor retinaculum and the tubercle of the trapezium. It is inserted into the metacarpal bone of the thumb on its radial side. The opponens pollicis muscle is innervated by the recurrent branch of the median nerve. Function of the opponens pollicis muscle is flexion of the thumb's metacarpal at the first carpo-metacarpal joint, which aids in opposition of the thumb. Examination of the opponens pollicis muscle. Ask the patient to touch the thumb and small fingertips together so that the nails are parallel. Try to feel the opponens pollicis muscle. Ask the patient to place the dorsum of the hand flat. Ask the patient to raise the thumb up straight to form a 90-degree angle with the palm, then palpate the contracting thenar muscles. The abductor pollicis brevis originates from the flexor retinaculum and the tubercle of the scaphoid bone. It is inserted into the lateral side of the base of the first phalanx of the thumb. The abductor pollicis brevis muscle is innervated by the recurrent branch of the median nerve, C8-T1. The main function of the abductor pollicis brevis is abduction of the thumb at the carpo-metacarpal joint. Examination of the abductor pollicis brevis. To assess for strength of the abductor pollicis brevis, place the patient's thumb into abduction and instruct the patient to resist movement while pressing the thumb into adduction. At the origin of the flexor pollicis brevis muscle, there are 2 heads. The superficial head originates from the flexor retinaculum and the tubercle of the trapezium bone. The deep head arises from the trapezoid and capitate bones, as well as the palmar ligaments of the distal row of carpal bones. The flexor pollicis brevis is inserted into the lateral side of the base of the proximal phalanx of the thumb. For innervation of the flexor pollicis brevis muscle, the superficial head receives nerve supply from the recurrent branch of the median nerve, whereas the deep head receives innervation from the deep branch of the ulnar nerve. The function of the flexor pollicis brevis muscle is to flex the metacarpophalangeal and carpometacarpal joints, leading to the opposition of the thumb and produces medial rotation of the thumb. Examination. The flexor pollicis brevis muscle can be tested and palpated on the thenar eminence when the thumb is flexed against resistance. Now let's talk about the hypothenar muscles. The hypothenar muscle group consists of the abductor digiti minimi, the flexor digiti minimi brevis, and the opponens digiti minimi. All 3 hypothenar muscles are innervated by the ulnar nerve. Since the ulnar nerve supplies the hypothenar muscles, damage or compromise to the nerve leads to atrophy of the hypothenar eminence. The abductor digiti minimi arises from the pisiform bone, the pisohamate ligament, and the flexor retinaculum. It is inserted into the proximal phalanx of the little finger. The abductor digiti minimi receives its innervation from the deep branch of the ulnar nerve. Function. The abductor digiti minimi muscle abducts the little finger at the metacarpophalangeal joint. When examining the abductor digiti minimi muscle, instruct the patient to abduct the little finger and press against the fifth digit, creating an isometric contraction of the abductor digiti minimi. The flexor digiti minimi brevis muscle arises by a short tendon from the hook of hamate bone and the medial aspect of the flexor retinaculum. It is inserted onto the base of the proximal phalanx of the little finger. The flexor digiti minimi brevis muscle receives innervation from the deep branch of the ulnar nerve, C8-T1. The main function of the flexor digiti minimi brevis is flexion of the little finger at the metacarpophalangeal joint. It also participates in lateral rotation and opposition of the little finger. When examining the flexor digiti minimi brevis muscle, ask the patient to flex the proximal phalanx of the little finger against resistance. The opponent's digiti minimi muscle arises from the hook of hamate bone and the flexor retinaculum of the hand. It inserts into the ulnar aspect of the fifth metacarpal bone and the adjacent palmar surface. Innervation. The abductor digiti minimi receives innervation from the deep branch of the ulnar nerve, C8-T1. Function. The opponent's digiti minimi serves to flex and laterally rotate the fifth metacarpal about the fifth carpometacarpal joint, bringing the little finger and thumb into opposition. When examining the opponent's digiti minimi muscle, check for muscle weakness by asking the patient to oppose the fifth finger to the thumb against resistance. Now let's talk about the interossei muscles, both palmar and dorsal interossei. The interosseous muscles of the hand arise from the metacarpal bones in the hand and help to control the fingers. There are 5 metacarpal bones in the hand. The interosseous muscles are inserted into the bases of the proximal phalanges. Metacarpal shafts give attachments to 4 dorsal and 3 palmar interossei muscles. There are a total of 7 interossei muscles. The 4 dorsal interossei muscles are also inserted into the extension-expansion of the corresponding extensor digitorum tendon. The function of the 4 dorsal interossei muscles is to abduct the fingers. No dorsal interossei are inserted into the thumb or the little finger. There are 3 palmar interossei muscles. The function of the 3 palmar interossei muscles is to abduct the fingers. The 3 palmar interossei muscles also assist the lumbricals in flexing the metacarpophalangeal joints and extending the interphalangeal joints. No palmar interossei muscle is inserted into the middle finger. The interosseous muscles help in the writing position of the hand by flexing the MCP joint and extending the PIP joint. The interosseous and lumbrical muscles' function is to flex the MCP joint, but they extend the PIP joint through the lateral bands and the central slip of the extensor digitorum communis. All 7 interosseous muscles of the hand are supplied by the deep branch of the ulnar nerve. Testing abduction of the index finger against resistance. The function of the first dorsal interossei is tested by asking the patient to abduct the index finger against resistance. The first dorsal interosseous muscle can be seen and evaluated on the dorsum of the hand. Severe atrophy of the first dorsal interosseous muscle could indicate severe compression of the ulnar nerve and a bad prognosis for recovery of this nerve. The condition of severe atrophy of the first dorsal interossei muscle can be associated with a claw hand deformity. Testing adduction of the index finger against resistance. The function of the palmar interossei is adduction. The examiner has the patient adduct the index finger against resistance. Check for clawing of the fourth and fifth fingers. Clawing of the ulnar digits occurs in low ulnar nerve palsy. There will be hyperextension of the MP joints due to the unopposed pull of the long extensors. The IP joints are flexed due to the unopposed action of the long flexors. The intrinsic muscles are weak and cannot extend the PIP joints. Let's discuss the anatomy associated with the lumbrical muscles. There are 4 lumbricals on the palmar side of the hand. The lumbricals arise from the radial side of the flexor digitorum profundus tendons. The lumbricals pass volar to the transverse metacarpal ligament. All the lumbricals are inserted on the radial side of the extensor expansion. The function of the 4 lumbricals is to flex the metacarpophalangeal joints and extend the interphalangeal joints. When the lumbrical muscles contract, it draws the lateral band proximally and pulls the FDP distally, which relaxes the tendon. Contraction of the lumbricals relaxes flexor pull on the DIP joint. The deep branch of the ulnar nerve innervates the third and fourth lumbricals, while the median nerve innervates the first and second lumbricals. Thank you for watching this video. This concludes our video on the anatomy associated with the intrinsic muscles of the hand. We will discuss other important anatomical structures of the upper extremity in additional videos.